Good evening, everyone. Nice to see you all. What a fantastically attractive bunch of people we have on the screen. So I really apologise that I'm going to have to flick the slide forward. I'll leave it there for a few minutes just to embarrass my colleagues a little bit more. So I haven't got any slides. It's actually, you have, hopefully in your hands, a copy of the annual report. It's a really nice document, I think, that will grace anybody's coffee table. So I'm planning just to take you through some of the key highlights that are articulated in the document. Just for a few minutes, because I think it would be really nice for us to be able to get on to the presentations from the team. So I'll just say a few words looking back on last year, and also a little bit about perhaps what the future holds for the organisation, and my reflection on standing here with you this time last year was that we were facing perhaps a different direction of travel for the organisation. Many of you will remember we were holding public meetings talking about partnerships and mergers with other organisations, and here we are in September 2013, perhaps with an emerging picture of a different kind of outlook, which I'll touch on a little bit later. It's worth saying, though, I think, that if you read the papers and believed what the newspapers tell you, both nationally and to some extent locally, you would think that the National Health Service, your National Health Service, my National Health Service, was failing and under siege. Every week, it seems, there's some news story that's saying how bad the NHS is. And whilst I think my colleagues and I on the board recognise that there's always room for improvement, and we're very committed to continue our journey of improvement. I think this document perhaps tells a different story about some of the achievements that your local organisation has been able to achieve over the last 12 months, then perhaps tells a different story to the way in which the media is portraying the National Health Service at the moment. And at that point, it's quite difficult, I think, for frontline staff in the health service at the moment to really try and feel proud of their achievements and proud of their work, because whenever they pick up a newspaper, there's always some criticism. If they're a nurse, they're being criticised for not being compassionate and caring. If they're a doctor, they're being criticised for some failings in medical management. If they're a bureaucrat like myself, obviously I'm overpaid, don't do much, and spend most of the time on the golf course. Which is incredible, really, because I don't actually play golf. So I think it's important that we recognise that actually the achievements that are articulated in this annual report are not delivered in a straightforward way. This is about the commitment of staff every day of the year, 24 hours a day, 7 days a week. So on page 4, you can see in Lawrence and our welcome, we talk about the year 2012, 2013. That was the financial year that ended on the 31st of March. And the Care Quality Commission, who I know you know is the health watchdog, visited both our hospitals, main hospitals, during the year, and identified that their assessment was that we're fully compliant with all of the stringent standards they set. It was also clear from the Dr. Foster Hospital Guide, Good Hospital Guide, which is a renowned, if you like, comparative document that compares hospitals nationally, that both our standardised mortality rates, so the extent to which we keep people alive in our hospitals, and the extent to which we make sure that people stay in hospital at the right time, they gave us very strong scores in those regards. Financially, Christian will talk a little bit more about the progress we made during that financial year, but we successfully, again, down to the hard work of our staff, were able to deliver an improved financial position, with a year-end target to be around £19 million in deficit, and we beat that by a fair chunk, over a third, coming in at 12.1 or thereabouts, with some impairments. In the meantime, we continue to invest. We built a new urgent care centre at St Helier with money provided by the Department of Health. We also used Department of Health money to improve our maternity units on both sites to make sure that our mums having their babies in our hospitals were receiving good care and in positive and nice and comfortable facilities. We also had the pleasure of Her Royal Highness Duchess of Gloucester helping to open our day surgery unit, and we spent in the region of 9 million in other investments across our hospital sites. So quite a lot of investment in the hospitals during the financial year that passed at the end of March. And also we had a strong focus on our staff, and as you'll see on page 8, we refreshed our values. You can see them on the top of page 8, focusing on putting our patients first, working as one team. So what does working as one team mean? There's emerging evidence across the health service that the best outcomes for patients are delivered by individuals working as effective teams, as multi-professional teams. You wouldn't expect in an operating theatre for the surgeon not to be working in partnership in a team sense with an anaesthetist and theatre scrub nurse, but there's a difference between good teamwork and really effective teamwork, and that's one of the areas that we're really going to continue to focus on. Also, respecting one another, protecting the environment, and this point about striving for continuous improvement. We know that there will be situations where there is room for improvement in the way in which we care for the patients coming through our hospitals, and we are working, as James will talk a little bit later, on trying to move towards an environment where we have an even stronger patient safety culture and an environment where each and every one of our 4,500 staff sees it as their responsibility to advocate on behalf of patients, but to safeguard the safety of patients coming through our hospitals. On page 11, you can see the reference to some of the national targets. A good performance, but disappointingly on our infection control targets in that financial year. We maintained the same number of MRSA bacteremias as the previous year, but had a slight increase on Clostridium difficile infections. Pleased to say year to date this year, because obviously we're almost 6 months of the year through, we've seen an improvement in both of those indicators, and we expect to deliver against those targets, such as they are possible to deliver against this financial year. So I want to register a thank you from me on behalf of the board for all of the hard work that our staff have put into delivering a strong performance, both from the CQC perspective, but also from the Department of Health's national standards. The other day I had the pleasure of sitting with one of our junior nurses who was moving on to a promotion in another role, and did an exit interview with her, so to understand how her 2 years at Epsom St Helier had been, what were the good bits, what were the areas where she felt there was still room for improvement. And a really nice conversation. At the end of it she said, well, Matthew, you used to be a nurse, don't you miss being a nurse? And I reflected to her that actually, yes, at times I do, but the privilege of leading an organisation such as this, that has seen this degree of improvement across a single year, is actually really fulfilling and an honour. And she was quite sort of struck by those words, so I thought I'd share them with you. But in all seriousness, actually, for an organisation with the strategic uncertainty that we've been facing during that financial year, to have improved in the rate that we have, both from a quality performance and financial perspective, I think is a real credit. And I pay credit to my staff for their hard work in that regard. Moving on to page 21, just want to note again the reference to the Francis report. We are really keen for our public and our stakeholders, in addition to our staff, to get involved in helping us to develop our response to some of the recommendations within the Francis report. And there's hopefully an opportunity to meet some people that are involved in that this evening, to hear from James what we're doing, but we'd really welcome your engagement in the future, because it's really important that we really understand exactly what it's like to be a patient and to be a frontline member of staff in the organisation in the context of the health service today. And then a little bit about the future. So on page 25 of the report, we're talking about the future of our hospitals, and as I said, at this time last year we were in active discussions with Ashford and St Peters about potential merger of Epsom Hospital. The merger was halted at that point in October, actually, and the reasons for that being on page 26. And the main reasons being the financial climate and the extent to which better services, better value created some uncertainty for Ashford and St Peters about the type of patient activity and therefore income that they could expect once they were running the services on this site. And as colleagues and partners will know, the better services, better value process is still ongoing. It is a cause of some concern that we are at a period where we haven't yet got to a point where the clinical commissioning groups have made a decision to launch a public consultation. And the concern, I think, for our board is that the organisation has been operating now in a period of uncertainty for a number of years, and that does start to have an impact on things like recruitment and retention and the everyday focus on putting the patients at the centre of everything we do. So we're continuing to work with the BSBV team to try to see if we can get to a definitive decision on launching public consultation, and I'm sure there'll be some questions on that later. And in terms of the redevelopment of our hospitals, particularly in relation to the redevelopment of St Helier, we can't move forward until there's a conclusion on BSBV, so that heightens our focus on trying to get some resolution to that. But in the meantime, we're not sitting still and waiting to be done unto. We are working with our clinical teams to see whether there is a different route to Foundation Trust status for Epsom and St Helier. Remembering that to be licensed as a Foundation Trust is not the end of the story. Actually, it's only a license to operate in the new NHS, and the main focus for us is really looking at the way in which we can create clinically and financially sustainable services into the long term. And once we're clear and the commissioners are clear as to the next steps for the SBV, we can then talk a little bit more clearly about what the next 5 years for this organisation might look like. And we're working very closely with the NHS Trust Development Authority to see how we develop a coherent business plan that safeguards services, improves services, but also continues the journey of financial improvement. And that's fundamentally what my job is and the board's job is to secure clinically and financially sustainable services for our hospitals. So I'm going to stop there, but before I do, I'm going to thank my team for all of their hard work and support over this year. We've had some refreshing of the team, but I'm absolutely confident that we've got the calibre of people that could continue and should and will continue to see the journey of continuous improvement through this financial year. So I commend the annual report to you, pay thanks to the staff, and look forward to questions later on.